Depression's biggest trick? Convincing you there's no way out of suffering. But there are exits. You just need to learn where to look. Hi, I'm Dr. Kiki Fehling, psychologist, author, and expert in dialectical behavior therapy, or DBT. If you're struggling with depression, you're not alone, and there are things you can do to make it better. In this video, I'll be teaching you 7 DBT skills for coping with depression. One thing before we start, there is a big difference between clinical depression or major depressive disorder and the typical depression or deep sadness that many people feel when they're going through a difficult time. I'll talk more about this important distinction at the end because it greatly impacts how you should use these skills. But for now, let me tell you about the skills. Number 1, non-judgmentally. Depression can turn you into an irrationally harsh critic. This coping skill helps you become a compassionate friend instead. When you're feeling depressed, your mind often gets filled with judgments like, I'm lazy, I'm worthless, or everything sucks. These thoughts are not facts. They are mean opinions that only make you feel worse. Non-judgmentally is a mindfulness skill from DBT that asks you to notice judgments and replace them with facts instead. Instead of, I'm lazy and worthless, you might say, I stayed in bed all morning. This isn't about ignoring problems or pretending everything is fine. You simply want to move from judgmental stories to facts. So you might say, I stayed in bed all morning and didn't get my work done, and now I feel guilty and overwhelmed because I need to make up for the time I missed. This change might not seem like a big deal, but it is. When you describe your situation clearly, without all of the added-on judgment, it becomes easier to figure out what might actually help. You can respond to your situation with kindness and wisdom rather than hopelessness and shame. Number 2 is self-soothing. Emotional pain deserves the same attention you give to physical pain. This coping skill teaches you one way to care for yourself when you're feeling depressed. The DBT skill of self-soothing is all about using your senses to cope and be kind to yourself when you're upset. You can use any of your senses to self-soothe: sight, hearing, smell, taste, and touch, as well as temperature, pressure, or movement. You could try the very stereotypical lighting scented candles, eating comfort foods, or taking bubble baths while listening to soothing music. But really, it's about doing whatever feels genuinely comforting and regulating for you. Depression can be exhausting. You deal with stress, harsh thoughts, and often physical symptoms too. Self-soothing isn't about fixing or changing your depression. Self-soothing is offering yourself physical compassion and care to make feeling depressed feel just a little bit easier. Number 3, mindfulness of current emotion. Depression is not always some terrible thing that needs to be fixed immediately. Yes, it's super painful, but when you've experienced real loss or disappointment, depression typically makes you want to slow down and rest, which may be exactly what you need. In these times, the DBT skill, mindfulness of current emotion, can help you actually process and feel what you're feeling. One way to practice this skill is to notice what your depression or sadness physically feels like in your body. Feel the heaviness in your chest, the tiredness in your limbs, or the tears in your eyes. Notice how the physical sensations change as you let yourself feel them. Of course, this can be incredibly painful and difficult. It's okay to start small, maybe practicing for only a minute at a time. It may help you to journal, create art, or move your body while you practice. If you get overwhelmed by hopeless or judgmental thoughts, take a break and use other coping skills. The goal isn't to feel better, but you may discover that when you stop fighting sadness and allow yourself to feel it, it shifts and it changes on its own. Number 4, opposite action. When depression wants you isolated and stuck, this coping skill helps you fight back. All emotions come with urges, things they make us want to do. Depression often makes us want to avoid people, cancel plans, or skip self-care. But acting on these urges often keeps depression going. The more we withdraw and avoid, the more isolated, disconnected, and depressed we tend to feel. Opposite action is an emotion regulation skill from DBT that involves doing the opposite of what your emotion wants you to do in order to stop feeding back into your emotion. So to practice, ask yourself, what is depression making me feel like doing right now? And then you do the opposite as much as you can. So if depression is urging you to stay in bed all weekend watching TV, maybe instead you get up and take a shower. You call a friend and go out with them to a new museum. Yes, I know when you're depressed, everything can feel exhausting or draining. Doing everything feels so very, very hard. Be compassionate towards yourself. And start as small as you need to. Rather than going out with a friend, maybe you invite them over to watch TV with you, or maybe you only text them. Rather than taking a full shower, maybe you wash your face. Rather than getting out of bed, maybe you just sit up in bed and open the blinds. Rather than responding to all of your texts, maybe just respond to one. Do anything that takes a step opposite to what depression makes you feel like doing. Of course, when you're depressed because you're processing a real grief, withdrawing and taking time to rest may be a good idea. But when your depression is based on judgmental thoughts, or when your depression is making you act in ways which just makes you feel worse, taking small steps towards opposite action can make a huge difference. Each step teaches your brain that you can do hard things, making the next step feel a little bit easier. And by acting opposite to depression, you're more likely to connect with other people and do things that prompt emotions besides depression. With enough time, opposite action can help you unstick from painful emotional cycles and help you find a more meaningful or enjoyable life. Number 5, checking the facts. Depression can be a very convincing liar. This coping skill helps you separate truth from emotional noise. Depression often comes with thoughts that feel very real and very convincing, but aren't necessarily accurate. You might think things like, they all hate me, I'm never gonna find a job, or things are never going to change. These thoughts are understandable. Everyone thinks darker thoughts when they're depressed, but they're also extreme and inaccurate. They're often more about the depression than about reality. Checking the facts is a DBT skill that helps you examine your thoughts more carefully so you can figure out how to respond to your emotions. You want to ask yourself 2 main things. 1, what are the facts? What actually happened that prompted my depression, shame, or hopelessness? And 2, what are my interpretations? What am I assuming, predicting, or adding on to the facts that might be making me feel worse? These questions are not about gaslighting yourself. They actually can help you validate and listen to your emotions, while still staying open to the idea that your thoughts might be misguided. Checking the facts can also help you think more flexibly, seeing more possible outcomes than your worst fears or most judgmental thoughts. So you can ask yourself things like, why do I believe this? What's the evidence for and against this thought? What are 3 different ways to view this situation? The goal isn't to be optimistic or to see things with rose-colored glasses, it's to be realistic, keeping in mind that depression makes everyone more pessimistic. Number 6, accumulating positives in the long term. When depression is clouding your vision, making everything seem pointless, this coping skill helps bring a meaningful future back into focus. Accumulating positives in the long term is a DBT skill for increasing your experiences of joy and fulfillment by taking value-based actions. Values are the principles that are most important to you in life. Things like justice, generosity, creativity, or courage. They're different from goals. Rather than to-dos you check off a list, they're broad directions that give your life meaning. This skill is about reconnecting with what your values are and then acting within them. So first, ask yourself, what has made me feel most alive and connected in the past? What do I most want to be remembered for? What are my deepest values? Then ask yourself, how could I spend my time in a way that is aligned with those values? What would I need to work towards, or how would I need to act? For example, if you value nature, maybe you try to find a job working for a climate change nonprofit, or maybe you volunteer at a local animal shelter, or just take time every day to walk outside mindfully. Value-based actions don't have to be big or impressive, they just need to align with what matters to you. When you're feeling depressed, it's easy to get lost in self-judgments and forget who you are beyond your struggle. Value-based actions can help you stay connected to your authentic self and build a life that feels more meaningful one step at a time. Number 7, self-encouragement. If you believe self-criticism is necessary for self-improvement, I've got news for you. You're wrong. Research actually shows us that self-compassion is way more helpful than self-criticism when we're trying to learn or do new things. This is going to be especially true when you're feeling depressed. The DBT skill of self-encouragement can help. Self-encouragement means talking to yourself the way you would talk to a good friend who has been going through a hard time, with compassion, understanding, and hope. Try saying, I can do this. I will get through this. Or I'm stronger than I know. Remind yourself of your strengths or how you've gotten through hard times before. If positive self-talk feels too difficult or feels fake at first, start with neutral statements like, this is temporary, this too shall pass, or I'm doing the best I can right now. The truth is, If you're feeling stuck in depression, you're gonna have to do some work to change your situation and get out of your rut. But depression makes everything feel harder. Being kind and encouraging to yourself will help you more than beating yourself up ever could. Okay, there you have it, 7 DBT skills that can help people cope with depression. Now let me address the important distinction I mentioned at the beginning of the video. When people talk about depression, they often mean different things. Sometimes depression refers to the deep sadness that people feel after loss or disappointment. This depression is a completely natural and common human response. Other times, depression refers to major depressive disorder, a clinical diagnosis where someone feels depressed most days for weeks, and it makes it really hard to live your life. The skills in this video can be helpful for both types of depression, but if you think you're dealing with major depressive disorder, learning skills on your own likely won't be enough. I strongly encourage you to connect with a licensed mental health professional. Depression is not a weakness or a sign that you're broken. Clinical depression is very treatable and you deserve support. Cognitive behavioral therapy, or DBT, have both been shown to help people with depression, anxiety, PTSD, and other mental health struggles. Also, this video is just an introduction. There are dozens more skills to learn, and full DBT therapy involves much more than just learning skills. To learn more about DBT or to find a therapist, visit Recovery.com or check out the resources listed in the description box below. Thanks for watching, and remember, using these skills takes practice, so be patient and kind with yourself as you learn.